Hi, I'm Dr. David Arneson. I'm a holistic physician. I'm a naturopathic medical doctor. I got into this medicine some years ago. I was a contractor in El Paso, Texas, and I had an alcohol problem. I woke up one day, I decided to do something different with my life. And what I did was I decided to re-educate myself. I have undergraduate degrees in biology and psychology as a double major. And then I went out and did other things, always kind of wondered how I put those pieces together. One time somebody was talking to me about holistic medicine, and I asked him, I said, what do you mean by holistic medicine? And he said, well, that body, mind, spirit medicine. I wondered who taught that. And I did some research, and I ended up going to the Southwest College of Naturopathic Medicine in Tempe, Arizona, and to go through medical school and to be trained in this holistic art. One of the things that appealed to me about this medicine was, when we talk about science, we talk about the mind sometimes, or the body. We've made this more mechanistic in our modern day medicine. And the body was one thing. There's certain ways that body has to operate. There's certain ways that we feed that body through nutrition so that it operates at its highest level of efficiency. Then we separate that out, and then we start talking about how the mind works. And then the counseling, or those things that we do, or the psychiatrist, or whatever, when we start looking at people with more emotional, psychological issues. And rarely do we ever talk about the spiritual nature of man, yet this triad exists in every man. So it gave us this opportunity to really look at what's happening on the scientific level or the biological level. How do we get back into the body the necessary nutrients, the necessary energy forms, so that the body works at its highest level of efficiency, as we said before. There's two parts to the mind, really. There's the body mind. That's the kind of a mind when you're in a gross anatomy class that you can actually take the mind out and look at it. It's ruled by biochemistry. It's ruled by physiology. There's certain ways that it has to operate. There's the other side of the mind, the emotional mind. That's proper operation is actually predicated on the body mind. So if the body mind is not in good operation, then the emotional mind is definitely not in good operation. Take, for example, if I in fact have a drug addict or an alcoholic or somebody who hasn't eaten well or is not nutritionally sound, and I don't have a physiology and a biochemistry of the mind that's in its sense of normacy, then how would I expect counseling to work on that person, especially on the emotional level, when in fact the physiology doesn't work well? So the first principle that we always look at is are we actually making sure that the proper nutrients are going in, that the patient is capable of absorbing and bringing in this nutrition and assimilating it so that their DNA or their genetics can convert these molecules to energy and enzymes and so forth. So we have this operation. And when we do that, or in the case of drug addiction and alcoholism, when we don't do that, what we see is these long-term chronic problems, what we call PAWS or post-acute withdrawal syndrome. And we actually know today that these symptoms like low-level depression, low-level anxiety, sleeplessness, sex hormone abnormalities, and so forth can actually last for 6 months to 2 years in the average patient. So then the first role for the physician is not to ignore this, but the first role in the physician is to make sure that we can take this body side of this human being and bring these levels or normalize these levels of normal biochemical molecules so that we have some sense of function, some sense of good function. In reality, when we do that through IV nutrition or amino acid therapy, whatever, what we find is that we can return this biochemistry, neurochemistry back into normalcy in the majority of the patients in 3 to 6 weeks. Now, this doesn't just apply to alcoholism and drug addiction. This applies to a lot of other medications that are given to patients, antidepressants and so forth. It also applies to the patient who is not eating correctly, who hasn't been putting into the body the correct nutrients to keep the GI tract healthy, to be able to absorb the nutrients that are necessary. So we're not just talking about drug addiction and alcoholism, we're talking about physiology, and we're talking about biochemistry. So when we actually normalize these biochemical molecules, these master neurotransmitters and so forth, what we see is this normacy of the foundation that actually is needed so that we can start working on this side over here, which is the emotional mind. So that the emotional mind has the concentration, has the focus in order to take in the information and utilize it. When we can do that, then we need to also address the spiritual quality of man. And the truth is, in reality, this is going to be the most crucial part of the growth of any human being. Human beings in general, since the Industrial Revolution, have lost this contact with this getting up every morning, having something they can go to that gives them a sense of meaning, gives them a sense of service to others. And so we often talk about the great sense of emptiness that seems to be prevalent in our societies now. This great sense of emptiness, this lack of purpose and meaning, this is actually the lack of purpose and meaning, or the lack of the ability to wake up in the morning and to find something in your life that gives you that charge, that ability to know that your efforts are worthwhile. When we take a look at the modern population and its disconnection by the Industrial Revolution and so forth, we're going to find that probably 65 to 80% of the people that are actually here in the Western culture anyway, that are looking at this specific issue. So when we start talking to a patient, we actually want to know several things. First of all, what is it that you would prefer to do? What is your dreams? What were your dreams? What were your aspirations? They might say, my dreams were this, my aspirations were that, and then we'll say, well, why don't you go do it? Their common reply is, I have a house, I have a car payment, I can't just quit and go back and do it. So my reply to that is, does this last forever in this consciousness? Are we going to live forever? Are we going to get all these opportunities in our lifespan? The common answer, of course, is no, it doesn't last forever. So then my reply to that is, so basically your unwillingness to walk into the fear of change, or to seize an opportunity to live your dream, you're willing to sacrifice for a car and a house. We've actually had patients that actually sold their house and sold their car and downsized and are doing what they love to do now. This process that we go through when we look at each individual patient, because it doesn't, like I said before, it's not just about alcoholism, drug addiction. These are symptoms of our great sense of emptiness, our great sense of dis-ease, or this lack of ease in our heart, this lack of believing in ourselves. In fact, this can happen with a lot of patients who have chronic illness. And one thing must be understood about chronic illness is that you measure your place in the world by your emotional mind. So the emotional mind attaches to the chronic illness and basically creates depression and anxiety because there's no way out. When we can understand from the emotional side the need to recognize the truth about the chronic illness, we can treat the chronic illnesses because so many of them can be treated, then we'll see the emotional mind accept that general premise that sometimes the negative is the best way to move. And many chronic illnesses basically are caused by the emotional mind, and the depression and anxiety goes from that sense of hopelessness or meaninglessness. And we have to look at this in a holistic sense. So holistic medicine is not just about herbs and acupuncture and homeopathy. Holistic medicine is about looking at that entire person the strength of holistic medicine is looking at the whole person rather than just a piece of you, not just fixing the physical, but addressing the emotional content of your illness, addressing the spiritual emptiness. Remember that the word spirit comes from the Latin word spire, which means to breathe, to feel alive, to have that sense of purpose and meaning. The saying is that only those who are willing to walk into the fear of change, only those willing to seize the opportunities and understand that life doesn't give you purpose and meaning, just tens of thousands of opportunities to find it, only those willing to seize the opportunity and walk into fear will find this sense of purpose, sense of meaning. When one does that, we're going to see hypertension fall, we're going to see obesity fall, we're going to see people get better physically because they have that sense of purpose, that sense of walking into the world every day, that ability to wake up in the morning and be ready to go, that ability to be of service to others. And it doesn't really matter what the question really asked in the past was, basically who's more important, the doctor or the garbage man? And I would tell you, and the garbage man would tell you probably, the garbage man for sure would tell you that it's the doctor, and the doctor would say, no, it's you. You pick up the garbage. We don't have pestilence, we don't have disease, we don't have all the things that would kill everybody else. So in this modern day, in this mechanistic medicine, in this piecing together of man doesn't work well. It hasn't worked well in a long time. So I'm a firm believer, I have no reservation, no doubt in the ability of holistic medicine and the things that we do to help people heal at the highest level.